Well, thank you for joining us, everyone. Today I'm excited to be here with two of my colleagues, Dr. Lee and Dr. Flaming. I'm going to tell you today a little more about my role as the acting COVID-19 public health coordinator for Iowa State. I'm going to touch on all the things that we've been working on here at the university with our COVID-19 efforts, as well as touch on how my veterinary training and public health training prepared me for this role, and some up and coming things that we're going to be working on. And then I'll pass it over to Dr. Flaming and Dr. Lee as well. So I wanted to start just by saying that I was asked to take on this role after serving on the public health team earlier this year. My role in that was mainly to help with some data and metrics, as well as planning our testing strategy. I was asked to take this role on about the middle of July. And so you can see I've transitioned to an office here at the Thielen Student Health Center. I work closely with the staff here at Thielen, as well as our Emergency Operations Center, and I'll talk a little bit about that here shortly as well. But first wanted to touch on just why I agreed to take on this role and how my veterinary training, particularly at Iowa State, helped to prepare me for the challenges and the work that we're doing. I will say it would be an understatement that I, personally feeling responsible for the health of about 38,000 people every day is very stressful, but I feel like my education did prepare me well for these challenges, and it's very meaningful work, and I appreciate the opportunity to serve our ISU community in this way. I did my DVM at Iowa State. I'm a 2011 graduate. And then I went on to receive my master's in public health at the University of Minnesota the following year. And my veterinary and public health training, of course, this won't surprise anyone, but infectious disease training, epidemiology, emergency management, all of those things certainly helped to prepare me for this role. But I think truly the skill set that we gain in veterinary medicine gives us a very unique and comprehensive approach to take on challenges like the COVID-19 pandemic. I think two big things are the critical thinking skills that we gain through our veterinary training, and also being able to take a systems-based approach. So being able to break these big problems down into smaller pieces, knowing how to collaborate, knowing how to work across systems, to work with other individuals who have different backgrounds from us, and being able to appreciate all the skills that everybody brings to the table. I am always very lucky to be able to say that I was trained by the best here at Iowa State. And as I said, it's truly an honor to now be serving my community in this role. It aligns well with my past work. Anyone that might know me, I used to work at the Iowa Department of Public Health, so I have experience there, and then did serve on our Board of Health as well for a short time. So I wanted to move into what we worked on in the months leading up to our students returning to campus, and then some of the activities we've been doing since then. We do operate under an incident command structure, so anyone who's familiar with that, we have a unified command structure here at Iowa State. Our Emergency Operations Center is housed within our Environmental Health and Safety Office. And they have been activated. Today is our 222nd day. So while I came into this full-time in mid-July from my position at the Center for Food Security and Public Health, some individuals on this campus have been working on this every day since the end of February. The decision to activate came when we decided to help bring our students home that were traveling internationally for study abroad. And then we've been activated ever since then. Later on, the public health team was developed. I mentioned that earlier, that I served on that. That's a group with individuals of broad expertise across campus. So we had everyone from finance experts to HVAC experts to health experts, certainly statistics experts. So truly trying to bring in people with the expertise that we needed from across campus. And what that team did was ultimately we developed, it's 105 pages now, but a public health plan that was a comprehensive strategy for how we were going to bring our students back this fall, and the mitigations that we were going to take to make that happen as safely as possible. That plan includes data and metrics, as well as indicators that we're monitoring, our testing strategy, case management and contact tracing, protocols and processes. It also touches on communication and outreach, mental health support, which is a huge component of this COVID-19 pandemic, and then vaccination planning. So influenza is a vaccine that we always plan for each year, but now COVID-19 is another vaccine that hopefully we'll have in the somewhat short-term future. And so we're planning for how that will be distributed here on campus as well once it's available. I also want to be sure and honor the work of the Fall Planning Committee. That group did an enormous amount of work leading up to our semester starting here on August 17th. They worked on things like classroom preparation. So we took our classroom, any in-person classes, down to 50% capacity. They did a lot of work making sure that seats were in the appropriate places, marked appropriately, so that we were able to physical distance our students as much as possible. They worked on ventilation assessments for each of our buildings and improving ventilation where that was needed, cleaning protocols, how those would work and who would be assigned. With our large campus, that's a huge undertaking. And so just a lot of coordination that took part within the Fall Planning Committee. And there were numerous, I wouldn't be able to even count how many work groups there were that worked with the Fall Planning Committee to make all of those things happen. We also now have a university response team in place that has a representative from each college on campus, as well as myself, members of the Emergency Operations Center, and Frank Peters leads that effort. He's the faculty member. And so we have that central university response team, and then we also have mini versions of that response team within each of our colleges. And that's really meant to be an on-the-ground effort to help answer people's questions. That was put together shortly after classes started. And we found that to be very successful in working through things that have come up since our students came back on August 17th. Don't want to overlook our Movein testing. I know that's something that certainly got a lot of publicity. So we did conduct nasal swab PCR testing in partnership with our excellent veterinary diagnostic lab here on campus. That was conducted on any student and was required by any student moving into our residence halls or on-campus apartments. That was also an enormous effort coordinated with our Emergency Operations Center, Department of Residence, dining played a role in that, of course, as well as our public health team here at the Thielen Student Health Center and with our partners in student wellness and beyond. We tested over 8,000 students in a 2-week time period. Our overall positivity percentage was 2.2%. And then any student that was identified as being positive for COVID-19 was moved into isolation housing. We have isolation housing here available on campus, or students are also allowed to go home to complete that isolation period. I'll talk more about our case investigation contact tracing efforts here shortly. But case investigations were done with each of those students to identify close contacts. Anyone who was identified as a close contact and potentially exposed to those individuals were moved to quarantine housing, separate from our isolation housing, but we have quarantine housing here on campus as well for those students, or they could also go home to complete that quarantine period. For an added bonus, I know all of you are aware by now, we had the derecho come through while we were doing our Movein testing in the middle of the day. Again, very thankful we were running that under an incident command system structure, and so it allowed us to proactively respond and be prepared for that incident that came about in the middle of 800 students being swabbed. We were able to keep everyone safe, physically distanced, and screen everyone as they came in the door to seek shelter from the storm. We have ongoing testing available on campus as well. I'll talk about where we're headed with that, but also what we're doing right now. So testing is available for any faculty, staff, or student that is symptomatic with symptoms of COVID-19, or anyone who's potentially been exposed to a positive case. Right now, that testing is being conducted at 2 mobile units at the Thielen Student Health Center. We are working very diligently and planning to have a more long-term new testing operation opening next Tuesday. September 8th at Johnny's in Hilton. This will provide us with a longer, more sustainable approach to our testing as the weather is going to be getting colder here shortly, and we won't be able to operate outside like we have been in our mobile units. That is going to increase our testing capacity. Again, Veterinary Diagnostic Lab has been a huge partner in all of that. We wouldn't be able to do any of this without them. So it's allowed us to have quick turnaround times on our testing, and we're using those mid-turbinate nasal swab PCR tests, which are highly sensitive. We'll continue to utilize the Veterinary Diagnostic Lab for testing at our new testing site. And of course, the testing task force continues to evaluate our testing strategy across campus. We're hopeful that with this increased capacity moving into our new testing site, that once we're able to meet the needs of our targeted testing that we're doing right now, so those people who are symptomatic or potentially exposed, that we can then offer some testing beyond that as well. So please stay tuned. We continue to evaluate the resources that we have available, being sure that we're good stewards of those. Our first and foremost goal is trying to identify positive individuals and their close contacts so that they can be isolated and quarantined to prevent the spread of COVID-19. But recognizing that we're hoping we can expand beyond that in the near future. Public dashboard is available now with our testing results. Many of you may have seen that was released this past Monday on our Iowa State COVID-19 website. You can link directly to it from there. We'll be updating again this coming Monday. That has a lot of information on it about the testing that we've been doing on campus so far. So we'd welcome you to visit that. And our athletics also does NCAA required testing that we assist them with, and they release their data as well on a regular basis. So I also wanted to mention, this isn't specifically affiliated with our efforts, but we have a Test Iowa clinic in Ames now out of the research park. So that's provided some added testing capacity. They do not report their cases through us, but we have systems set up for individuals to self-report positive cases who are tested at any site external to Iowa State. And anyone, and we've been asked this several times, so just wanted to touch on it, but we do report all testing results to the Iowa Department of Public Health. There can be some delays in how all that is analyzed, so the numbers don't always match perfectly each day, but Iowa State does report their tests through them. And then our state and local, as well as Iowa State partners, work very closely together to make sure that cases are not counted twice or not missed being counted. And cases are counted by their current address. So that's another question that commonly gets asked. So just wanted to briefly touch on our case investigation and contact tracing process that we have here at Iowa State. We're very proud to be able to help our local public health partners increase the capacity, knowing that with our Iowa State community population being here, we have a lot of individuals, and we wanted to be able to support those efforts to make sure it was happening in a timely manner. We continue to increase the capacity of our case investigation and contact tracing teams. We've more than doubled the size of them in the last couple of weeks to help continue to ensure those timely responses. So anytime that anyone tests positive through our Iowa State testing or self-reports to us that they've tested positive through an external testing site, such as Test Iowa, but there's others certainly, a thorough case investigation is conducted by our case investigation team with each positive case. They're given guidance on isolation, CDC guidelines, what to do if they're experiencing symptoms. And then another big part of that process is to identify close contacts and anyone who may have been potentially exposed to them during their infectious period. Once those close contacts are identified, we have a contact tracing team, similar to our case investigation team. This is a trained group of individuals that reaches out to each of those close contacts that have been identified. And those individuals are given CDC guidance on quarantine procedures. They're also given a symptom tracking check-in every day to make sure that they're monitoring for any symptoms that they might develop. And they're given testing guidance as well. That's been changing with CDC over the past few weeks, but we continue here at Iowa State to offer testing for potentially exposed individuals. And as I said, we are continuing to expand, excuse me, our contact tracing and case investigation teams. So lastly, I don't want to hog all the time and want to be sure we have time for questions, but one of the things you may have seen for those of you who are in the Ames area is our Cyclones Care campaign. This is something that I'm really proud of. We have been able to partner here at Iowa State with our campus partners, but also with our community partners. And so the city of Ames, we work very closely with them, and they agreed to adopt our same signage. And so we have been able to keep that message consistent across our entire community. That signage can be seen. We have a billboard on Duff Avenue, if anybody's seen that, by Duff and Lincoln Way. We have signage all over campus, banners, banners on the light posts. We have digital communication about that. And then we also have stickers and other things that we're handing out to students on campus who are following these Cyclones Care campaign strategies. And that campaign revolves around our 4 main mitigation strategies that we're truly asking all faculty, staff, students, and community members of the City of Ames to abide by. And that includes wearing a face covering, washing your hands frequently or sanitizing your hands when you can't wash them, physically distancing, and then one of the most important things is to stay home if you're sick. And that is something we, I think, all struggle with at times. We're all very busy, but we've been really trying to work hard to make sure our community is supportive of our students, our staff, and our faculty if they're sick, that we really want them to stay home to prevent the spread of COVID-19. And so with that, I'm happy to take questions afterwards, but speaking of the staying home when you're sick, a big piece of our strategy here on campus has been to remind folks every day that are part of our ISU community to be mindful of any symptoms that they may have. And so we've implemented a really fantastic symptom tracking system that Dr. Flaming is going to speak to now. Thank you.
Good afternoon. Thanks, Kristen, for that overview of what's going on at Iowa State in response to COVID-19 and the role you've played in that and how your veterinary training has helped with that. My role, I'm also a veterinarian, but my role has been on the IT side, so kind of in the background. And one of the things that prepared me to do that, in my day job, I think of myself as a translator. So I can speak geek and I can speak medical. And so standing in between those two fields, aiding in the communication, is the role that I've primarily filled in this response. As Kristen said, the Cyclone Cares behaviors, one of the last one, stay home when you're ill, was to, I apologize for the dogs, they're pretty consistent in knowing when I'm on Zoom. I'm guessing yours do as well. We're looking for a technology tool to help move all that data that Kristen talked about. So you've got people who need to be tested. The diagnostic lab does some testing. Those results have to then be reported back out. The individuals need to hear about it. Those that are positive need to go to another group who call them and do the case investigation. During that, they have to record who the close contacts are, and that data has to be shifted then to a different group who contacts the close contacts. So there's a lot of data that's moving around in that. What I've found is the most important part of that system is the people. One of the things that has struck me as I came into this was the incredible care that the Teelan Student Health Team has for the students and the ISU community. It would be very easy to, see this as just an endless list of tasks where you've got to, get people tested, you got to get the results and just turn the tasks. get those things done. But at their core, these folks are really committed to providing good care to people. And, when us IT folks suggest, well, it'd be a little easier if you just turned that into an email and didn't call them. And they're like, no, wait a minute. We got to call those people. They need to hear somebody cares about them. There are mental health issues that we're dealing with. There are, they just need to be encouraged. Regardless of what you send them in an email, they may not read it. Amazing. So what we did initially was the small piece that every person at Iowa State is contacted, asking them to complete a very simple survey. Are you experiencing any of these various symptoms related to COVID-19? Yes. Well, yes, but I've had that for a long time, or no. And then based on their answer, if they say no, great, come on to campus. Go about your normal activities. Make sure you're wearing your face covering, socially distancing, and washing your hands. But if you say yes, well, hey, please stay home. We don't want you to come. And here's some place you can contact to get more information about testing, more specific health information. Seems like a pretty simple thing, right? You just send everybody an email, simple question, and give them a simple response. Well, it was a lot more complicated than I thought it was going to be. Just getting a list of everybody to send emails to. Well, anytime you have a system like that, there's some data that's not quite right. Initially, we were struggling. We had 300 emails that weren't getting delivered. We wanted to give people an option, knowing that many students and others would prefer to get this by text. So setting up a mechanism by which we could send them an email and then collect their phone number, or actually encourage them to change their phone number in the correct place. We couldn't just say, do you want it by text? Because we have a phone number for everybody. Those phone numbers aren't correct. At least they're not to the individual. Many of them may be to a parent, a guardian. It may be to a landline that can't receive a text. So a number of issues there. Initially, our questionnaire was, yes, I have symptoms. No, I don't. Well, quickly we heard from people, hey, I got allergies. If you say, yes, I have symptoms, I'm going to be saying that for the rest of the year. And I'm not sick. Well, we adapted pretty quickly. The very first contact, this was a personal story. Have you ever hit send on about 40,000 emails? We've tried to automate the system as much as possible, but that first one we did manually. And yeah, I've sent out emails to a few hundred people, and I double, triple check them. When you're going to 40,000, it's like, yikes, better get this right this time. So some of the benefits of automating that, prior to that, the people in student health had created a system with what they knew how to do. And initially, when things were low, they were texting students every day to check on them. Hey, how's it going? We've been able to automate that system for them. Rather than somebody sitting with a phone for a couple, 3 hours, just manually texting people, we've been able to automate that. One of the big benefits we've also been able to achieve is data visualization. So they were getting raw data back, and there'd be this list of people saying, yes, I have symptoms. No, I don't. Here's my symptoms. And so you'd have to scroll through this big old spreadsheet, and it wasn't lined up, one person's answer today or yesterday, today, across. They'd just be different lines on the sheet. So that was really challenging. We've been able to then, with a data tool, present that in a way that's much easier to scan and see. We can color code it. People with reporting 6 or more symptoms, it turns red. And then you can see if they've got red things. Okay, wow, we better maybe check up with that person. Again, going back to that caring for the person. Give them a call, find out, hey, is it, are these really mild symptoms? Are you really, really sick? Do you need encouragement to go see a healthcare provider? So IT has been a tool to, I think, improve the care that we're providing to the community, but it's also a challenge when you're switching things midstream. You've had one system, you got to switch to a new system. You're busier than you've already been. Adding one more thing, it just is just too much, or can be, and it's really a challenge. One of the things I do want you to think about is go back to toilet paper. Remember when this all started and we all started staying home and everybody stocked up on toilet paper, and suddenly there was no more toilet paper. Our systems in general function when things are kind of at the steady state. You know, I buy toilet paper last week, you buy it today, Kristen's gonna get it next week. It works when we all do that, but if we all gotta get it this week, we're out. Well, Iowa State has the employees and staff that it has. And suddenly we've got to respond to this huge outbreak. Huge. Sorry, Kristen, that was a bad thing to say. I'm talking on a world scale huge, not Ames huge, okay? Even though we were number one, we're no longer. So all the people that are doing this work are people who are doing their existing job or trying to maintain their existing job and doing this on top of that. And so it's been a real privilege to work with an amazing group of people who are really committed to protecting the Iowa State community and taking care of our students and the employees here at the university. Well, I've kind of given you enough of the IT stuff. I can see your eyes are kind of starting to glaze over, and you're afraid I'm going to start talking about databases and queries and et cetera. We've been focused on Iowa State. Now for the much broader perspective, we're going to switch to Dr. Lee, who will give you the county, the state, national, and international perspectives.
Well, I don't know about all that, but thank you, Dr. Flaming. So to give you a little background for those who don't know me, I'm Dr. Molly Lee. I'm an Associate Director at the Center for Food Security and Public Health here at ISU-CVM. I'm also a 2014 graduate of ISU-CVM and spent some time in private mixed animal practice in North Central Kansas after graduation. Returned to Iowa to get my Master's of Public Health degree from that other school in Iowa. And began at that same time a job with CFSPH. So here I've worked primarily on projects related to foreign animal disease preparedness and response, zoonotic diseases, and education of various veterinary audiences within these areas. So to jump right in and give you a taste of what it's like being on the Board of Health for our county during a pandemic. This is a volunteer position outside of my responsibilities at ISU, although as I'll mention coming up here, it does involve very close collaboration with people at the university. So I applied to this position, I believe last summer, and it is a 3-year term. So in general, the responsibilities of the Board of Health, it is the County Board of Health is considered a local Board of Health, and it depends on exactly where you are, if that's county-based or some large cities could be considered a local Board of Health. So in general, we have jurisdiction over public health matters within our county. And we promote and protect the public health of our citizens and carry out powers of local boards of health, which are pretty general. These are laid out a little bit in Iowa code, but in general are quite vague and pertain just to protecting the health of our community. So ideally, and primarily, and especially during normal times when we're all a little bit less busy, we do this mostly through employing specialists to efficiently discharge our duties. So for example, one of our responsibilities relates to environmental health. So we have an environmental health department under our jurisdiction who performs duties related to environmental health. which are things like permitting and inspection of wastewater and well water and wastewater treatment, things like that. But more relevant to what we're discussing here today, Story County Public Health is also under the jurisdiction of us as a board. And so Story County Public Health contracts for services with Mary Greeley Medical Center. So that's how our normal daily operations take place, is through our Director of Public Health, who is a public health nurse at Mary Greeley, and her staff. So as Story County Public Health, some of their responsibilities which we oversee include emergency preparedness planning and prevention, disease prevention, surveillance and follow-up, response to disasters and assistance in recovery, senior health and immunization programs. And then there's also a couple more specific areas that they spend time in, such as tuberculosis control and lead poisoning prevention education. So Story County Public Health and our public health nurses really do a lot of the work and are the boots on the ground. So they coordinate closely with Iowa Department of Public Health, as well as particularly during this pandemic, Story County Emergency Management. So specifically related to COVID type activities, some of the things that our Story County Public Health has been involved in include beforehand developing a pandemic response plan. So this is something that local boards of health have in place, and as soon as this became an issue here in the United States and Iowa, immediately that plan was pulled out, looked at to make sure it was current, and any needed updates were addressed. Story County Public Health is the incident commander for our county in this emergency. Dr. Obing talked a little bit about the incident command system. So we also as a county play into that and follow that structure. So public health is incident command within this situation. Some of their major duties include monitoring that case data. And again, as Dr. Obing mentioned, kind of talking with the university, talking with Iowa Department of Public Health to make sure numbers that everybody is getting are kind of jiving with one another. Additionally, contact tracing. So initially, our public health department was completing that contact tracing, but as cases grew, it did become overwhelming. So that currently is something that the Iowa Department of Public Health is doing on behalf of Story County. They have many more trained contact tracers than we do, so they've been able to efficiently complete that on our behalf. But we are still involved, Story County Public Health is still involved with contact tracing, particularly, for example, the schools. So if there's a positive case and a student is at a public school, then we will handle that here within our county. Additionally, Dr. Obing mentioned the Test Iowa clinic. So our public health department was very involved in trying to get that clinic here and coordinating everything to set it up. They're taking a lot of calls this week. I don't know if anybody has called trying to get a test there, but they're very, very busy trying to get all the calls for that. So that's been something that they've done and has been really beneficial to our community. Additionally, a lot of education. So especially as the school years were ramping up for our school children, there was a lot of conversations with school nurses and superintendents on how to hopefully reopen the schools safely. So our county public health was very involved with that, as well as ongoing discussions with nursing homes, long-term care facilities, places like that. And then again, very close coordination with Iowa State. So our director has very frequent conversations with Erin Baldwin here at the university, and very, very close collaboration with ISU, since Iowa State is a significant contributor to the population of our county. And then a kind of a final thing related to something that Story County Public Health does relevant to COVID is in the upcoming future they will be very involved with those discussions related to vaccination. So right now we're going over the point of distribution plans for the county. So when vaccine becomes available, the county will be the point of distribution for who receives that vaccine when. So as a Board of Health, we get regular reports on all these activities from our public health director. and we have the opportunity to ask her questions, offer feedback on these things, but they are very well trained and very capable. So we try to just let them do their job, and it goes very smoothly. So as a Board of Health, some of our roles separate from that, related to COVID, have been primarily coordination with and outreach to others. So one important aspect of this is really just listening to our community members and staying up to date on things happening within our community. So again, keeping tabs on everything that's happening within the university, the mitigation measures that they are proposing within the university for the students, the things that is happening with ISU athletics, what's happening within cities within our county, as well as in the unincorporated areas. So a major component of that is the city of Ames, because they have the largest population, but also the cities of Nevada, Gilbert, Story City, the surrounding area in our county. And then again, I mentioned the schools. So we do have 7 school districts within our county. So trying to keep our finger on the pulse of what's happening with the schools, listening to those school board meetings, listening again to those city council meetings, and also not only with the leadership in those areas, but getting a sense of public opinion and feedback of what these jurisdictions are doing. And then we have a lot of collaboration within the members of the Board of Health. So there's 5 of us on the board. And so we don't, all attend every school board meeting or listen to it remotely. But we try to take a good sampling of what we can and share it with one another, as well as with the Board of Supervisors here in our county. So then after we kind of listen and get a sense of what leadership is doing and what they're thinking and what they're needing in these various jurisdictions, as well as the public, then we figure out if and when we need to step in and offer some additional public health guidance or public health opinion. So our number one job as public health medical experts within our community is to provide sound health guidance and communicate that to the appropriate entities. Some examples of how we've done that in the last few months. In June, we published some guidance for everybody in the community. This was, again, just guidance, nothing, no mandates or anything like that, but it talked about general best practices and sort of distilled down that information that was available from the Centers for Disease Control and from the Iowa Department of Public Health and other entities. And we tried to help say, this is what this looks like in our county. This is what this means. Here's what we feel is best aligned with those guidelines, but explained a little bit more specifically to our situation. And then in July, we worked with quite a few different groups as they were trying to hold events safely. So for example, we worked very closely with the Story County Fair to figure out how they could continue with a lot of their fair events in a way that would reduce exposure to any potential virus that might that people may be exposed to through participation with other people at the fair. And then things like races or other different events, we consulted with people that would come forward to us and ask our guidance and kind of approved or made different recommendations on their plans. And then in August, we sent a letter asking municipalities within Story County to regulate face coverings and also provided some specific guidance on what that face covering ordinance or whatever they would be able to pass would look like. So as a county, we explored doing this independently as well, and I'll get into that too for what we are doing in a minute. But a lot of what we do day to day involves working closely with other officials within our county. The Board of Supervisors is one, and our county attorney has advised us that we're not able to enforce a mandate or an ordinance currently when you're looking at the laws in general for Iowa related to face coverings. So I'll talk about how we're approaching that here in a little bit, but in the meantime, I'm sure folks have heard in the news, there's different interpretations of the law, and so we wanted to provide resources to other jurisdictions within our county if they did feel that they could pursue a face covering mandate of some sort, their legal advice was that they could do so, then we wanted to offer them resources to do that. So what we're currently working on now, kind of backing up to what we're doing as a county related to face covering ordinances, is we have one drafted that does include penalties, and we are set to have a public hearing on that in the next week. So it's next Tuesday Tuesday at 6 p.m. in the evening. So we want the public to offer their feedback, and we will take that into consideration, make any revisions as we feel is appropriate after we get that public feedback. And then we'll send that up to the Board of Supervisors so that if and when they do have the authority to put that into place, it's ready and we don't waste any time getting that on the table, because we feel that's a really important protective public health measure. So beyond those specific activities, really, again, what we're doing is kind of just reiterating those key messages, which are the same as those 4 pillars in the Cyclones Care campaign. So face coverings, physical distancing, staying home when sick, and hand washing and sanitization. And then supporting our Story County Public Health Department and making sure they have enough resources to do their job. So they are really a small but mighty group. They do a lot with a little, and we want to make sure that we can support them. And then finally, one of our roles as a board has been communication with media. So whether that's TV stations locally, radio interviews, newspaper articles, or trying to get our guidance out in those newspapers, speaking with legislators, speaking with political candidates. We've done all of those things to try to explain to these individuals what health and what the mitigation measures are looking like in our community. And then again, most importantly, taking that feedback from our citizens and considering that and making sure that they're a part of everything that we do for the public health. It relates to protecting the public health of our citizens. So we definitely want them to be involved in this process. So I guess to wrap up, I found my training as a veterinarian to be very relevant to this position, particularly during COVID. So, you know, it seems a little bit outside the box, but really designing a COVID mitigation plan for a summer event was pretty easy because I've designed biosecurity plans for farms, and it looks a lot like that. I've been able to effectively communicate scientific information about COVID mitigation, known how to prioritize messaging because of the practice I've had doing that with clients and communicating with clients about recommended treatments. I can, you know, I understand how disease spread works, so I can prioritize the most important mitigation measures, communicate that, and really just, you know, review, understand, and communicate that scientific literature to a lay audience. So it has been a fun way to use my DVM degree. And I won't say that it's not stressful at times, because it certainly is, but as Dr. Obing said, it's really rewarding, gratifying. I feel like the work is meaningful. And so despite when I joined the Board of Health, I did not expect to be involved in a worldwide pandemic within the first 6 months of my appointment. It's been really a good way to try to advocate for and protect and support my community, and to be involved with democracy within our community. So I think that's about all I have, and I can toss it back to you, Tracy, for answering any questions that might have come in.
Thanks, Dr. Lee. And we do have a question, and Dr. Obing, if you can answer that question, that would be great. Has to do with cases identified by the Iowa Department of Public Health and reported to the university.
Yeah, so happy to answer that. This question came from Clara. So first, just want to clarify, Clara, that IDPH, while we report cases to them, due to confidentiality regulations, they do not report back down to us. So that's why we need individuals who test outside of TLIN. We do have those test results, but for individuals who test outside of TLIN, we request that they self-report to us. We do include the self-reporting data in our public dashboard, and that was released this past Monday. So if you go down It's underneath our on-campus testing data. We don't combine it with the on-campus testing data because we don't have a denominator for that. So because we're requiring self-reporting, we don't know how many negative tests there were like we do with our on-campus testing. And so in order to be transparent and keep our data accurate, we have those self-reports out separately in their own line graph. If you have further questions, let me know. Hopefully that answered that.
And Dr. Lee, we have a question for you. COVID is dominating the local public health issue. What other public health issues are surfacing in the wake of COVID?
Yeah, that's a great question. So absolutely, COVID has been completely dominating everything we've been doing lately. But of course, regular health of community members is important, and issues do go on. There would be things we'd be dealing with normally. So one of those is vaccination for other diseases, particularly influenza and school vaccines. So as individuals have been advised to stay at home, try not to go out, there's been a lot of potential, students being schooled from home, doing homeschooling or online learning. And so there have been some parents who may or may not have gotten the vaccines that are needed for their kids. So that's probably been one of the, I guess, trickle down effects from so much public health attention being paid to COVID, is that we're a little concerned about vaccines being utilized for other important diseases that we need protected against. So we do have influenza vaccine that has just come in for fall vaccines. And so we're encouraging folks to go ahead and go out and get those vaccines. We don't want, influenza issues on top of COVID-19 issues. So we encourage folks to do that. And we've been trying to campaign and get the message out for that as well. But that's probably been one of the major issues that's not COVID related to public health.
Thanks, Dr. Lee. Seeing no additional questions in our Q&A box, I'd like to take a moment to thank Drs. Obink, Flaming, and Lee for their time and giving us an overview of their additional public health pandemic roles. I'd also like to thank everybody for attending, and have a good week. Stay safe and healthy. Thank you.